Tell people the difference between public health and healthcare and how they should describe it when they're sitting around the dinner table.
Yeah. So healthcare is what people are more familiar with, right? It's what happens in the clinic, in the hospital. It is very individual patient focused. Public health is largely funded by the government, which is in contrast to healthcare. Much of healthcare is in the private sector in this country. Not all of it. Medicare is a great example. Medicare, by the way, is socialized medicine, which people don't want to hear, but it is. So you have largely taxpayer money, some philanthropic foundation money, maybe some public-private partnership, but most of public health is taxpayer dollars. It is looking at health from a population, hence public health perspective. And so it's not decision-making for an individual patient. And I think this is one area where people got frustrated during the pandemic because you had these blanket recommendations for how do we reduce disease and death at the population level. And some people would say, yeah, but that's not me, and so they would not see themselves as being at risk, for example, and are not necessarily thinking about not just what, say, COVID infection means for them, but what it might mean for the people around them. And so those are just different ways of how do you weigh risk and benefit of certain different things. Another way to think about public health is it's all the stuff that does not happen in a clinic or hospital. It's all the stuff like, what's your air quality, your water quality? What is the safety of your neighborhood? Is it so violent you can't go out for a walk and exercise in your neighborhood? What is your access to healthy food? Those are the kinds of things we think about in public health. And that's not something you address with a prescription pad or a surgery. A lot of our levers in public health are really about policy and how do you shift the needle through policy.